My name is Ron Brooks, and I'm an assistant professor in the Department of Family Medicine at UCLA. I am also the Director of Research and Evaluation at Bienestar Human Services. I'm here today with my co-presenters, Amanda Landrian Gonzales, who's a research intern at Bienestar Human Services. She is also a second-year doctoral student in public health at UCLA. I'm also here with Omar Nieto, who's the project director for the LA PrEP Stories project, which is out of the Department of Family Medicine at UCLA. So if our title seems sort of cryptic, numbers and voices, I think it'll become clear once I describe the two studies that we will be talking about today. So we're really going to tell you two stories about PrEP among Latino MSM here in Los Angeles County. The first is our numbers, and this is a sub-study that was done with Latino MSM, who were participants in a study called Project Protect Yourself, or Proyecto, Protégete, which was done through Bienestar and was funded by the California HIV AIDS Research Program. The voices are actual voices of Latino MSM who use PrEP, and this is part of the qualitative interviews that were done as part of the LA PrEP Stories project, which is a study looking at the lived experiences of those who are using PrEP. So here's the outline for today's presentation. I'll provide a brief overview of HIV infections among Latino MSM, a brief overview of PrEP and PrEP adoption among Latino MSM, and then I'll turn it over to Amanda, who will talk about the numbers portion of our presentation, and then over to Omar, who will talk about the voices. I will return and talk about some concluding remarks based on the findings from the two studies and some of the recommendations that we have developed in terms of trying to figure out a way to increase uptake of PrEP among Latino MSM. Now, for our presentation, we're using the term Latino MSM to be inclusive of both those who identify as gay and bisexual and those who do not identify as gay or bisexual but do report same-sex behavior. So this is information that probably most of you know. Latino MSM are disproportionately infected by HIV, and that the CDC says that 1 in 4 Latino MSM will contract HIV over their lifetime. While evidence has suggested that HIV infections have stabilized among MSM in the period from 2011 to 2015, that was not the case for Latino MSM. Their infections increased by 14%. In Los Angeles County, Latino MSM account for the largest number of new infections among MSM of all racial ethnic groups. So it's really this continuing pattern of high rates of infection that underscore the need to really promote HIV prevention with this particular population. So let's talk about PrEP. PrEP is the newest, latest biomedical HIV prevention strategy, which really has the potential to dramatically shift the HIV epidemic among Latino MSM and other high-risk populations. We know that PrEP can be up to 90% effective if it's taken as directed. That means taking it every day and basically the same time each day. So just a brief overview. In 2012, the FDA approved Truvada for the use of Truvada for PrEP for HIV prevention. In 2014, the CDC issued clinical guidelines for administering PrEP to high-risk populations. And while we've seen that PrEP uptake has increased over the years, the one group where it hasn't, or one of many groups where it hasn't, is among Latino MSM. For example, so in 2015, there were 3,000 Latinos, or I should say, uptake among Latinos and African Americans. So in 2015, there were 300,000 Latinos who could have potentially benefited from PrEP, but only 7,600, or 2.5 prescriptions were filled by Latinos. Now, specifically among Latino MSM, multiple studies have shown that compared to white MSM, Latino MSM have a lower rate of uptake of PrEP. So, and it's really, for us, it's really this disparity that sort of contributes to the existing disparity in HIV infections, which we see within this population. So next, we will look at findings from 2 studies that specifically focus on Latino MSM here in Los Angeles County.
Okay, good morning, everyone. As Dr. Brooks mentioned, my name is Amanda Landrian Gonzales, and I'll be presenting findings from our study, Proyecto, Protégete, or Project Protect Yourself. So I'd like to first begin by just providing a little bit more background information on our study, and I'll begin with just highlighting our study objectives. So our primary objective for this study was to address a gap in the current literature by assessing PrEP awareness, accessibility, acceptability, and use among both English and Spanish-speaking Latino MSM in Los Angeles. We also sought to examine predictors of PrEP awareness, accessibility, and acceptability among Latino MSM who are not currently using PrEP. So in Project Protect Yourself, Latino MSM were recruited through gay-oriented sexual and social networking apps. So these included Growler, Grindr, Jacked, and several others. And then they were invited to come complete a brief survey in either English or Spanish. The survey collected information on demographic characteristics, substance use, sexual behaviors, as well as PrEP awareness, accessibility, acceptability, and use. The analytic sample that we used for our study was restricted to a subset of 276 Latino MSM who had tested negative for HIV and who had completed the survey questions related to PrEP. So here we have a map that shows the geographic diversity of the participants that we included in our study sample. And what we really want to highlight here is just that we were able to successfully recruit Latino MSM from across Los Angeles County, and that it wasn't just that a bulk of our participants were coming from just one specific area. So in our study, we found that only 16 of the 276 Latino MSM included in our sample were currently using PrEP at the time of the survey. So that represents a prevalence of PrEP use of only 6%. These 16 men were generally younger in age, and they had more than a high school education, and all of them were English speakers. 2 of the 16 men reported to be undocumented. So the remaining results are now going to focus exclusively on those Latino MSM who were not using PrEP at the time of the survey. So after you subtract the 16 PrEP users from the sample, you're left with 260 participants who, again, were not using PrEP at the time of the survey, and that is the N that you'll see reflected on these slides. So as you can see, most of our non-PrEP users were younger in age. Almost 15% were monolingual Spanish speakers, and 10% were undocumented. So we also asked participants to indicate their country of birth. 71% of our participants were born in the United States, 20% were born in Mexico, and 4% were born in El Salvador. The remaining 5% were born in other Latin American countries. Among those 76 participants who were not born in the United States, the average age of arrival to the US was 17 years, and that age ranged from 1 year to 46 years. Continuing with our demographic characteristics, we found that our sample of 260 non-PrEP users were fairly educated, most reporting to have more than a high school education. We also found that 3/4 of the sample were employed either part-time or full-time, although we also found that nearly 75% were earning an annual income of $30,000 or less. As I mentioned before, the survey also collected information on substance use and sexual behaviors. We found that 12% and 13% of participants reported to have used meth and cocaine in the past 12 months, respectively. Participants also indicated several notable high-risk sexual behaviors. that were reported by a majority of the participants, and this included having anal sex without a condom, having anal sex with a man under the influence of alcohol, as well as having multiple sex partners. So in terms of PrEP awareness, accessibility, and acceptability among our sample of Latino non-PrEP users, our results showed that PrEP awareness was quite high at 85%. However, among those who indicated that they had heard of PrEP, only 35% knew how to access the medication. Again, among those who reported to have ever heard of PrEP, we also found high acceptability of PrEP, with close to 3/4 of participants indicating that they would be likely to use PrEP in the future. So now I will review the results of our multiple variable analysis, examining predictors of PrEP awareness, accessibility, and acceptability among our non-PrEP users. So to run these analyses, we used multiple logistic regression, controlling simultaneously for any variable that we found to be associated with our outcomes at the bivariate level. So when examining predictors of PrEP awareness, we found that lower education was associated with lower awareness. So those with a high school degree or less were 20 times less likely to be aware of PrEP than those who had a college degree or higher. We also found that having a higher number of sex partners was associated with higher awareness. So our results showed that those with 6 to 10 sexual partners were 5 times more likely, and those with more than 10 sex partners were 6 times more likely to be aware of PrEP than those Latino MSM who reported having no sex partners or 1 sex partner in the previous 12 months. When examining predictors of PrEP accessibility among those participants who were aware of PrEP at the time of the survey, we found that those with lower education were less likely to know how to access PrEP. So specifically, we found that those with a high school education or less were 2.5 times less likely to know how to access PrEP compared to those with a college degree or higher. We also found that undocumented participants had lower accessibility, whereby those with undocumented status were 5 times less likely to know how to access PrEP than those participants who were US citizens or legal residents. Finally, we examined predictors of PrEP acceptability, and again, this was among those who were aware of PrEP at the time of the survey. We found that lower education was associated with higher acceptability. Specifically, we found that those with a high school education or less were 3 times more likely to indicate that they would be likely to use PrEP in the future compared to those with a college degree or higher. Number of sexual partners was also found to be associated with PrEP acceptability. So our results showed that having a higher number of sex partners was associated with increased acceptability. So we found that those Latino MSM with 6 to 10 sex partners were about 8 times more likely, and those with more than 10 sex partners were 10 times more likely to report that they would be likely to use PrEP in the future. Again, this is compared to those Latino MSM with no sex partners or 1 sex partner in the previous 12 months. So from our findings, I think we can draw a few important conclusions. So first, our sample reported high awareness of PrEP and high acceptability of PrEP, and they also noted several notable high-risk behaviors, but very few men were actually using PrEP at the time of this survey. We also found that Latino MSM with lower education were more likely to indicate that high acceptability of PrEP, but they were less likely to be aware of PrEP or to know how to access the medication. So efforts to increase PrEP uptake are going to really need to focus on improving awareness of PrEP and knowledge around accessing PrEP, particularly among Latino MSM with lower educational attainment. And there's also a need to increase PrEP accessibility among undocumented Latino MSM. So of course, our findings have to be considered within the limitations of our study, mainly that our recruitment, again, was done through gay-oriented sexual and social networking apps. So Latino MSM who don't use these apps or who use them infrequently, our results may not be generalizable to that population. Well, thank you. That concludes the overview of Project Protect Yourself. I would now like to introduce my colleague Omar Nieto, who will present findings from our qualitative work.
Good morning, everybody. As my colleague Amanda mentioned, my name is Omar Nieto, and I will now be presenting our findings from the LA PrEP Stories project, which is the voices portion of our presentation. So the study objective of the LA PrEP Stories project was to explore the experiences of Latino MSM PrEP users who were using PrEP in order to facilitate uptake among this population. So between January 2017 and October 2017, a purposive sample of Latino MSM PrEP users were recruited from gay-oriented sexual and social networking apps, so like Grindr and Growler, community events, and then community agency referrals. A total of 29 Latino MSM PrEP users then completed an in-depth, semi-structured qualitative interview. And then participants also completed an audio computer-assisted self-survey, or a CASI, to provide information on their demographics and PrEP use characteristics. And then thematic analysis was used for the analysis of all of our qualitative data. So in terms of their demographics, the average age of our participants was 30 years old, and age ranged from our youngest being 21 and our oldest being 49. At the time of the interview, the majority of folks identified as either gay or homosexual, and had at least completed some college or more, with many receiving a BA or a BS and higher. To continue, at the time of our interviews, a majority of our participants were also insured, so they had health insurance, and they were currently employed, which included both full and part-time work. But the annual household income for our participants was still $40,000 or less. And in terms of their PrEP use, the average length of time on PrEP for our participants was 17 months, so that's about a year and a half. And the length of time on PrEP ranged from one participant being on PrEP for a week and another participant being on PrEP for 68 months, or 5.5 years. So the first thing we did in our qualitative study was we asked our participants what their main reasons were for beginning PrEP. And one of those big reasons was our participants identified that they began PrEP after making a personal assessment of their own high-risk sexual behaviors. So this included having a preference for condomless sex, having multiple sex partners, being in an open relationship, or having a prior experience with either contracting an STI or having an HIV scare. Other reasons why our participants decided to begin PrEP because they were either in a serodiscordant relationship, so they were negative but their partner was HIV positive, or they simply had a lot of partners who were also HIV positive. And the last reason why our participants began PrEP was after receiving motivation and encouragement from both their peers and sex partners to begin PrEP, and that really demonstrated the importance of having other Latino MSM PrEP users tell them about PrEP in their decision-making process. So that we then asked our participants to identify challenges that they experienced in being able to access PrEP. And the one thing about our participants was that they didn't actually experience many challenges in access. But the one consistent challenge that our participants did experience was that of having a primary care physician who lacked either PrEP or LGBT competency. So in terms of lacking PrEP competency, that means not knowing the basic information about PrEP, not knowing about eligibility requirements in terms of who's eligible for PrEP, and for those who were uncomfortable, they also didn't know external resources for then where to refer their patients. So what this did was that it forced some of our participants to have to locate providers outside of their networks that were capable of prescribing PrEP. And in many instances, this meant having then to switch their health insurance over to the new medical facility. So then, stepping away from our participants' experiences, we then asked them to assess what they believe are barriers to uptake among other Latino MSM. So in this discussion, our participants discussed some general structural and logistic barriers. So they talked about how there is this lack of access to insurance among Latinos, that there is a lack of reliable transportation to the location of PrEP services, and that there were time conflicts for work, so that they saw that other Latinos in their communities, that they weren't able to call off work in order to make the routine 3 to 6 month follow-ups. Our participants then acknowledged barriers that were specific to monolingual Spanish-speaking Latino MSM and undocumented Latino MSM. So as this participant describes, one, the language barrier. There's not that many people who are capable or who are able to talk about PrEP in Spanish, specifically in clinic settings, and then the awareness. If there are programs to help them, they're not aware of them, and they're too scared to even ask because they're more worried about getting deported than trying to access this pill. And so what this quote shows is how both undocumented status and language, how these both can be barriers to access for other Latino MSM. Along these same lines, our participants also discussed this general lack of PrEP exposure in communities of color and this larger perception that PrEP is only accessed by and for white MSM. So this participant describes, it needs to not be a white social construct in the gay community. The access needs to be given more because if not, then you're going to have a gay white community that's going to lower its HIV rate. But why is it that black gays and the Latino gays, their HIV goes up when the same pill's available to all, but it's not accessible to all? Another barrier that was specific to the Latino community was also this general lack of engagement with healthcare services. So they talked about before any type of PrEP education could happen, that you first need to address the barrier of engaging Latinos with preventative care. And then another barrier that our participants recognized was just the lack of PrEP and or LGBT competent providers, which were experiences that our participants also had. So the first participant says, I would say doctors and nurses should know about PrEP. But there's still instances where a lot of providers don't have the information, resources, knowledge, or even a referral of where to go. And so that's addressing the lack of PrEP competency. And the second quote, I've had a doctor who's come off kind of condescending about the kind of sex that I have engaged in. It makes me want to be less communicative with them. So I think they need to be trained on communicating or even just being more open-minded or more tolerant or open-minded about things. And the last barrier that our participants addressed was just how various stigmas, how they might act as a barrier to PrEP access for Latino MSM. So one of the stigmas that our participants talked about was PrEP stigma. So they say the stigma of people kind of pinning you as this sexual deviant because you're on PrEP, and also assuming that because you're on PrEP that means that you have to and you must engage in risky sexual behaviors. Our participant also then talked about this existing HIV stigma that's within the Latino community. So they said, I would say the stigma of HIV in general, it's just the very fact that it's related to HIV. And finally, our participants talked about how gay stigma might be a barrier to access. So this participant says, for a lot of Latinos, you don't come out. Why are you going to seek something that's gay-oriented? They're not because of the stigma growing up. I'm not gay, therefore even though I have sex with men, I'm not gay, so why do I need a gay pill? And so here it's really talking to this fact of Latinos who are not open about their sexuality or who, like Dr. Brooks mentioned, don't identify with being gay, that they're less likely to access this pill because of the negative stigma that's attached to gayness. We then asked participants to then assess what they believe was needed in order to facilitate uptake of PrEP among Latino MSM. And to do so, we then framed our next set of questions based off the information, motivation, behavioral skills model, which was first adopted in 1992. And so what we did, we framed our questions to identify the requisite information, motivators, and behavioral skills that are needed to achieve a specific behavior change. And the behavior change we're talking about here is both adopting and then remaining on PrEP. So the first question that we asked our participants was, what type of information do Latino MSM need to know about PrEP to decide if it's right for them? And so in this discussion, our participants talked about information that all PrEP consumers need to know, or potential PrEP consumers need to know before they begin the medication. And so this first is knowing that PrEP is effective at preventing HIV, but that it's best used with other HIV prevention methods. And so they really wanted to stress that PrEP is meant to be a supplement to other HIV methods and not a replacement. They also thought that PrEP users should know that PrEP is affordable and accessible, and that for those who have concerns about affordability, that there are assistance programs available to help them be able to afford the medication. And then finally, that PrEP is easy to use, that it's a once-a-day pill, but that really adherence was key to the overall success of PrEP. The next thing we did was ask participants what they thought would motivate other Latino MSM Latino MSM to use PrEP. Similar to what was discussed before, our participants talked about the importance of having testimonials from other Latino MSM PrEP users. So they said, letting Latino MSM know that somebody that looks like them or has a similar story to them was able to access this and gain something from it. Our participants also said, having other brown men tell men about it. I am more prone to taking something if there's someone who looks like me tells me about it. So they really wanted to stress the fact of having brown and black men being the face of these types of biomedical interventions to dispel that belief that PrEP is only accessed for and by white MSM. Another motivator that our participants talked about was the knowledge that PrEP can reduce the stress and anxiety that's associated with sex. So this participant says, I think PrEP is very empowering, and I would use that to be my message to other guys. Like, you can say fuck it and take this pill and be like, I like to fuck, and I don't want to worry about HIV, and being engaged in healthcare is going to keep me healthy. And these were sentiments that were actually also expressed by our participants when we asked them how they felt about using PrEP, because they routinely said that since they started, that it allowed them to feel more responsible about their healthcare, that it gave them a greater sexual freedom, and that for the very first time, that it reduced the anxiety with having sex, and that they were able to actually enjoy sex. Other motivating factors is knowing, again, as I mentioned before, that PrEP is effective in preventing HIV, knowing the facts about the HIV rates among Latino MSM, so really hitting on what Dr. Brooks mentioned in the beginning, how heavily and critically impacted Latino MSM are in LA County by HIV. And they also thought that a good way to motivate Latinos is by increasing marketing specifically to Latino MSM using a variety of modalities. So this includes using social media, tailored and language-specific pamphlets and brochures, and then also having buy-in from opinion leaders. The last thing that we did was ask our participants about the skills that Latino MSM need in order to be able to access and then remain on PrEP. So that's a behavior change. One of the first skills our participants talked about was that Latinos need to develop effective patient-provider communication skills. So this participant says, it's owning and accepting your truth. So a person would be like, I'm gonna go to this doctor and I don't need to lie. I'm a gay man and I have the right to be treated as such, and I need as such and to stay healthy this way, and I need you to use your tools to keep me healthy. So they really wanted to stress that we need to be able to get Latinos to a place where they could accept and own their sexual identity and their behaviors, and to also recognize that PrEP providers are there to ensure their overall sexual health and well-being. Our participants then acknowledged that our Latino MSM also need to be able to develop PrEP disclosure skills. So first, they need to decide who they want to tell that they're using PrEP, and then they have to think about how they're going to tell them. And so our participants, they recommended one potential way that you could frame this conversation when you're disclosing your PrEP use. So this participant says, I was very careful when telling my mom because I wanted her to know, because I think that it's ultimately something that's going to give her a peace of mind. So I had to very much frame it like, this is my second line of protection in the same way that a girl could use birth control and still use condoms. So they really wanted to stress that when you're disclosing it, that one thing that you could potentially do is just reiterate that PrEP is really meant to be an additional layer of protection. And the last thing, since our participants acknowledged how important adherence was, they recommended a variety of adherence skills that they thought that Latino MSM could benefit from. So this included using pill boxes, phone reminders, or tracking your adherence with calendars and or other PrEP users. And they really just wanted to stress that for Latino MSM to find the strategy that works and makes the most sense for them, and then to personalize that. So in conclusion, our qualitative interviews with Latino MSM highlight several ways to promote and facilitate PrEP uptake among other Latino MSM. Although some important limitations to keep in mind, with the qualitative portion, all interviews were conducted in English, and that a gap still remains in the research with monolingual Spanish-speaking Latino MSM who are using PrEP to identify the challenges that they experience and the barriers that they felt like, from their perspective, are then preventing other monolingual Spanish-speaking Latino MSM. And then again, because all of these interviews were conducted in Los Angeles County, that our results may not be generalizable to Latinos in other settings. So that's it for the PrEP Stories project. I'm now going to turn it over to Dr. Brooks to have some concluding statements.
So thank you, Omar and Amanda. While many of our findings may already align with what you suspected or know about PrEP use among Latino MSM here in LA County, based on either your work with the population or just your experiences in general, we hope that the data now provide you with actual empirical evidence to support those kinds of statements and conclusions, and that it's evidence that you can use to seek additional resources to help increase uptake among PrEP within this population. So let's start with some of the positive trends identified in both studies. Two of them, well, PrEP awareness is high among Latino MSM, and this has been increasing over the years since I've been doing PrEP research for over 10 years now. PrEP acceptability is also high. Again, this is also increasing, has been increasing over the years. But more importantly, among those Latino MSM who are currently using PrEP, they've had very positive experience with their PrEP use. But several issues remain. One is that currently uptake is very low and needs to be increased dramatically. PrEP accessibility is also low, and so there's need for more information about how to access PrEP. And there's also stigmas that exist within the Latino community, which may be a continuous barrier to PrEP uptake. So PrEP, gay, and HIV stigmas need to be addressed. And as Omar mentioned, a particular gap in the research that exists right now is this lack of information on PrEP-related issues among monolingual Spanish-speaking Latino MSM. We also mentioned that marketing PrEP to Latinos needs to be sort of directed to those with lower levels of education. But beyond sort of getting them to start PrEP, we need to start monitoring PrEP adherence, persistent use, and reasons why they may discontinue using PrEP. So here are a couple of, or a few recommendations that we have. One is increasing knowledge of access may not be enough if Latino MSM encounter barriers when trying to access it or stay on PrEP, barriers from providers. So there really is a need to increase PrEP literacy, particularly among primary care providers, which is the point in the healthcare system where Latino MSM should be asking about PrEP. And so this should include just general knowledge of PrEP, who's eligible for PrEP, and if the provider can't or is uncomfortable prescribing PrEP, being able to actually refer them to those resources where they can get PrEP. Providers should also be more comfortable in terms of conducting sexual histories, but particularly providing these services in a manner that's specific to Latino MSM and that is language specific. So the way we're looking at PrEP is based on the Transtheoretical Model, or stages of change. So if you think about it, this is how we're looking at PrEP among Latino MSM. So the pre-contemplation, the PrEP pre-contemplation stage is the point where the men are saying they don't want PrEP, they don't identify as a good candidate for PrEP, and they don't see their behaviors as being high risk. So it's really getting those men and moving them along the different stages from contemplation, preparation, to action and maintenance, which is where they initiate PrEP and we help them stay adherent to the medication. So that's the process where we see needs to happen. And the one way we think it can happen is using a brief intervention that's based on the IMB model, where we've been collecting information on. So we believe that the IMB model can address the low accessibility with information that's specific to this population, and also with the behavioral skills that they need to navigate the healthcare system when accessing PrEP, such as being able to have open communications with providers, feeling comfortable asking questions about medication, et cetera. The intervention can also address the disconnect between high awareness, high acceptability, but yet low uptake by including information, providing information that's specific to the population and addressing the motivators that they need to adopt PrEP. In particular, What we heard is that men really appreciate the personal testimonials of other PrEP users, particularly Latino MSM PrEP users. Also, we think that we also need to help them identify the intra and interpersonal motivators to remain HIV negative. And we also need to improve PrEP literacy among the population. So in a manner that's tailored to the population, because what we know is that PrEP awareness really doesn't equate to comprehension or understanding of what it means to use PrEP. And our last recommendation focuses on the stigmas that currently exist in the community, which may be a barrier to PrEP uptake. While there are some anti-gay stigma interventions that can be somewhat successful, the ones that we have identified that might be useful are the mass media campaigns and community level interventions, but also interventions that have a more specific target with either a subgroup within the Latino MSM population. So as you can see, a lot remains to be done to increase uptake with this population. So we hope we can move forward together to help achieve that. That concludes our presentation, and I'd like to thank you for your attention, recognize our funders, the staff that worked on the 2 research projects, and the Latino MSM who participated in both studies. Thank you.